One of the most devastating complications of atrial fibrillation is a stroke. And as physicians, we spend most of our time and energy trying to prevent stroke. And we do so with medications and anticoagulants. But treatment of atrial fibrillation, the abnormal rhythm, is also important as it improves quality of life. So what we wanted to understand is if we can better treat the abnormal rhythm, if perhaps we can lower stroke, particularly in patients that have had a prior history of stroke and are at much higher risk of having another. So we looked at approximately 140 patients and compared them to patients that had atrial fibrillation that didn't have the most aggressive treatment, ablation, and those that were just treated with medications. And what we found that patients that have had a prior stroke that undergo an ablation compared to patients that have atrial fibrillation that don't experience much lower stroke rates. In fact, the rates of stroke are nearly cut in half, and this translates into a survival benefit.